Chair recognizes Mr. Johnson for 5 minutes.
Thank you, Mr. Chairman. Mr. Cohen, I too would like to thank you for being here today. You know, we've had a long and arduous journey since this all started, and the American people came under the Affordable Care Act back last October, the website going up. You mentioned in your testimony that you know, the problems that we had, that it wasn't time to give up, it was time to roll up our sleeves and get to work. Well, I respect that, but I'll submit to you that we've got a little bit of a different idea about what roll up your sleeves mean. You see, the American people, businesses, individuals, hardworking taxpayers across this country who are increasingly burdened by the big spending, over-regulating policies of this administration. Not very many of those folks get a second chance. Only in Washington, D.C. and with this administration do we see a constant pattern of redo at somebody else's expense. In this case, it's the American people's expense. So I submit to you that what we should have done, what the administration should have done, is roll up its sleeves and do this the right way in the first place. Let doctors and patients manage their health care. We've got a private sector health care system that has provided the best health care in the world. It did not have to be done this way. Well, let me get to a few specific questions. Since the launch of Healthcare.gov, Mr. Cohen, has the site been subject to any security breaches?
No.
No security breaches?
There have been no breaches in the sense of anybody attacking the site and being able
to... There have been no incidences of people attacking?
No, where they were successful.
That's what you just said.
Well, because you interrupt me, Congressman, I don't get a chance to finish what I'm trying to say. No, there have been no successful attempts of where anyone has been able to attack the system and penetrate it.
Wow, that is contrary to what we've heard in other testimony and what is widely known in the media.
Mr. Chairman, I respectfully disagree with
claiming
that.
Claiming my time. What is the difference, in your opinion, between a security incident and a security breach?
You could have a security incident where, because of an error or a mistake, or somebody sent something to the wrong place, or that was an isolated, specific incident where information was transmitted in a way that was incorrect. A breach. When I hear breach,
how do you relate that back to the testimony that we've heard before the Energy and Commerce Committee, that security was never even factored in and tested prior to standing up the website? So. Can you promise the American people today, right now, that their personal information is secure on website.gov?
Yes. I can't promise that there won't ever be an incident, but I can promise that their information is secure, and I can promise that
sounds like an oxymoron to me. You can't assure that there's not going to be a breach, but their information is secure.
That's not what I said.
Let me ask you a follow-on question. Can you promise to this Congress that if Healthcare.gov is subject to a breach or a hack or any security failure, that you'll alert the Congress as soon as you find out about it?
We follow normal procedures and protocols for when those incidents happen.
But the American people need to know, and this Congress needs to know. So can we get your agreement that you'll notify Congress if that occurs?
We'll certainly work with you to make sure you get that information.
Okay. Whose job is it to inform Congress and the American people when a security breach occurs? Whose job is that?
CMS has an Office of Security, Information Security, that's responsible for that, and is today in the case of the Medicare system, where we have 50 million enrollees that whose data.
I got it. CMS is responsible. Who is responsible for the overall cybersecurity of the Healthcare.gov site?
I think that's the same.
Do you know how many people in CMS are dedicated to protecting the security of Healthcare.gov?
I couldn't tell you a number of people. I know we have a dedicated security team. I know we do continuous monitoring. We actually have people watching the site 24 hours a day, 7 days a week.
Do you know how many contractors are involved?
I don't.
Do you know how much money? Do you know how much money is being spent to provide
security? I would have to get that number for you.
Does anyone report to you regarding the security of the site?
My office is not responsible for the security of the site, but I am given reports on anything.
Okay, can you give us examples of those reports so we can see what those reports include?
I can certainly take that request back and see what we have.
Okay, well, I mean, they come to you, so you ought to be able to release them, right?
I can certainly take your request back and see what we have.
Okay, well, Mr. Chairman, I yield back.
Mr. Chairman,